everyone. Thank you for having me here.
I'm super excited for this webinar. I feel like I've learned so much from Dr. Hemon Park already, but I know that there's so many questions and would love to, dive into.
At Cellora, we define regenerative aesthetics more broadly than a single procedure or stem cell treatment. Our philosophy began at Geo Clinic with a simple idea. The goal is not to make someone look like somebody else, but to help each patient become a healthier and better version of themselves. At Cellora, we decided to take that philosophy one step deeper because what we see on the outside can sometimes reflect what is happening inside the body as well, and vice versa. So when a patient first comes to Cellora, we look beyond the visible signs. We actually begin with a comprehensive assessment before we talk about stem cells or any specific regenerative treatment. We take a look at the face through imaging that evaluates the skin texture, elasticity, pigmentation, and contour. We assess the body with 3D by scanning when appropriate. And we also use functional testing to understand factors such as inflammation, hormones, pigmentation, and contour. We assess in simple terms, we look at the face, the body, and what is happening internally. Only after that assessment do we discuss whether regenerative treatment is appropriate. We want to know what is this patient actually trying to improve and what does the assessment tell us. Depending on that answer, regenerative treatment may become part of the plan. It may be combined with other aesthetic or functional approaches, or we may recommend something else entirely. Stem cell therapy is an important part of our anti aging approach, but it is not the whole program. RenewCell is Cellora's premium regenerative care package within this broader system. And for us, regenerative aesthetics is not simply about adding a new treatment. It is about understanding the patient more deeply and helping them become a healthier and better version of themselves.
I think regenerative aesthetics has become a buzzword, but it's become so popular because I think patients and consumers are looking for something that is, in essence, renewal and tapping into the body's own ability to heal itself and to produce more collagen, to stimulate a healing process that minimizes fine lines and wrinkles and produces a visible effect and transformation. And so when I think about regenerative aesthetics in the US, right, treatments that come to mind are microneedling with radiofrequency, fractional laser treatments, really, even a basic peel, right? A chemical peel is regenerative, but I think that we're talking so much more about it because we are coming out of a sort of in the US where there's filler fatigue. And so instead of adding volume and adding product or even for, neurotoxin, which is a wrinkle relaxer, I think patients are craving something that is more healing and a regenerative experience.
So, before I explain how we select a treatment, I want to introduce a concept that may be familiar in East Asian medicine. There is a term called bibyong. It describes a state where a person has not necessarily been diagnosed with a disease, but they don't feel completely well either. Maybe you wake up and don't feel refreshed. You recover more slowly after exercise or stress. Your sleep is not as restorative as it used to be. You feel more fatigued, or you simply feel that your body doesn't bounce back the way it did before. These can be very common experiences as we age. And this is important to how we think about regenerative care at Cellora. If we think of aging not only as a change in appearance, but as a gradual change in our body's ability to maintain function and recover, In that sense, everyone who is aging may be someone we can evaluate from a regenerative and longevity perspective. But that does not mean that everyone needs stem cell treatment. Stem cell therapy is not a one time cure for aging, and that is not how we use it at Cellora. Our real goal is longevity, helping patients maintain their health, function, recovery, and quality of life for as long as possible. So for us, stem cell therapy is one important regenerative treatment option within a much broader longevity strategy. And that is where Renew Cell comes in. When a patient enters the Renew Cell program, we don't begin by asking, should this patient receive adipose derived cells or bone marrow derived cells? We begin by asking, what is changing in this patient and what might be driving that change. On the day of treatment, we look at the patient's symptoms, medical history, current clinical condition, and the diagnostic information available to us. We also use our accumulated clinical database to look for patterns that may help us understand where the patient's functional decline or recovery issues may be coming from. Based on this initial assessment, we determine whether regenerative treatment is appropriate, and if so, which approach may be the best starting point. For cellular treatment, we may consider different sources, including bone marrow or adipose tissue. These are not simply two different ways of delivering the same treatment. They have different cellular characteristics, and this becomes especially important when we are planning treatments over time. In the short term, there can be overlapping regenerative and anti-inflammatory considerations, but as we collect more information from the patient over time, the choice and sequencing of cellular treatments can become more individualized. But again, the cellular treatment itself is only one part of Renew Cell. Based on the assessment, we may also build individualized lifestyle modifications around nutrition, exercise, sleep, stress management, and other areas, and consider additional medical interventions when appropriate. Then, as the full diagnostic results become available, we build a longer term plan. This is where longitudinal data becomes very important. We don't want to look at one laboratory result or one treatment in isolation. We repeat relevant assessments, look at how the patient's data changes over time, and use that information to refine the next stage of the program. So, Renewcell is not designed as a single procedure with a beginning and an end. It is a longitudinal program in which assessment, treatment, lifestyle, and follow up continuously inform one another. So ultimately, our goal is not to give more stem cells. Our goal is to make better decisions over time about how to support each patient's longevity. One important advantage of the regulatory environment in Korea is that under the appropriate clinical framework, we can harvest non-cultured cells and administer them to the patient on the same day. This is very important to how we operate Renew Cell at Cellora. But being able to provide the treatment is only one part of the system. Regenerative medicine requires the appropriate clinical infrastructure, trained medical personnel, standardized protocols, and oversight to manage the entire process safely. From patient assessment and cell harvesting to processing, administration, and follow up. And as you introduced GeoClinic in the beginning, GeoClinic was designated by Korea's Ministry of Health and Welfare as an advanced regenerative medicine institution. And this clinical framework allows us to build experience with regenerative treatments within a structured system.
What's really interesting, having visited your clinic, Dr. Park, is that there seems to be at least a certain degree of regulatory kind of a relationship that wants to develop the technology, right? Korea has a certain licensing system that allows for certain clinics to be certified to do this level of care. And from it branches out to just allowing for it to be an environment where there is research and innovation that occurs.
So we seek to actually do more interesting things with in the cell treatment area. And as the regulation allows, I think this is the best we can get to in the approach of regenerative treatment for now. But we're uh, currently working in a broader and deeper aspect of using our own cells from our body for like more futuristic treatment options. And that study is ongoing, and the government is giving the license to certain institutions who seek to do that.
I think there's definitely a gap in what is the tools that are available to us in the US right now versus the innovation that's going on abroad. But at the same time, I think that, in the US, I would say very commonplace procedures are, again, the microneedling, use of fractional lasers, utilizing skin boosters such as PRP, as well as topically treating with exosomes or certain growth factors, even PDRN, and newer. There are liquid extracellular matrix products that can be used topically that are used here, post treatment. And I would say those are the tools that we have currently. At ARAM, we are part of a clinical study, and we have partnered with Acorn Biolabs, which is a Canadian company, and it's a really, exciting and novel method to source stem cells. So traditionally, stem cells are sourced from whether it is adipose tissue through a form of liposuction or through a bone marrow aspiration. These are more invasive, obviously, techniques, but Acorn has developed a procedure where by plucking hair follicles, they are able to isolate stem cells and cryopreserve them. And in addition to just banking stem cells, they are able to create a cultured medium. And so that is called the secretome. And the secretome is not PRP and it's not just exosomes. And secretome is really this cultured media that has autologous. So it's autologous exosomes and growth factors and peptides. And the secretome is lyophilized and then placed into vials and then shipped to the provider. And we use the secretome, reconstitute it, and utilize it after microneedling and laser treatments. And so the clinical study that Aram was a part of is the role of secretome, is assessing the role of secretome on facial rejuvenation. And I know that there's another clinical study underway in terms of utilizing secretome for hair regeneration. And so these are really exciting technologies that are available to us in the US right now, as we also look abroad and globally to see all of the different ways that stem cells are being used in both aesthetics and clinical applications. I think one thing to understand as we learn more about stem cell therapies is that there is a very clear indication between what is considered manipulated tissue versus not manipulated. And that's a really important distinction because I think, we think about PRP. PRP is a product after we process blood, and we're not manipulating the cells in any way. We're not culturing them, so it's considered not manipulated or minimally manipulated tissue. But when you think about culturing stem cells and then and potentially sort of changing the way that the cell can interact within the body, then there are very, very, very strict guidelines. And I'm sure Dr. Hemmenpark can speak more to this, but as I follow what's happening in Japan, and I've also been following what's going on in sort of the stem cell and like neurodegenerative treatment space, especially when it comes to Parkinson's and dopaminergic neurons. So Japan has been really leading some of the very cutting edge clinical trials in this type of stem cell therapy research. So I think that's where we're also going to learn a lot from.
So, as I talked about it earlier, there has to be a good amount of pre-assessment, like what your body is lacking, where is falling. And actually the best source to get the certain good amount of stem cells would be actually adipose derived cells. But in Cellora, we are more familiar with bone marrow derived cells because, to put it simple, the procedure is actually easier than getting cells from adipose fat tissue. It actually needs just one poking in the hip bone with it's quite a thick needle, but still it's just one poking, and the extraction takes only 10 or 15 minutes, and you can recover really quickly and go back to your daily life almost right away without any downtime or recovery needed. So we have a busy life. And those people who visit Cellora, most of them all lead very busy lives, and they want improvement, but in a short amount of time if possible. So many of them choose bone marrow derived cells. I mean, we talked about Japan right before this. If we could culture adipose derived cells, then it would be more useful in Korea. But since we cannot do that yet in Korea, bone marrow derived cells, we use it more often in Cellora.